again, this is another vlog regarding how to become a nurse here in Ireland. So I already tackled about the nursing adaptation and the RCSI aptitude test. So this video is all about how to survive, or what are those attitudes and traits in order to obtain or to be successful in this adaptation period. So for me, as a personal advice to the future adoptees, there are 5 traits that you need to learn. First is being open-minded. Being open-minded means that I know that you have loads of experience, like 3 to 4 years of experience from somewhere else, aside from Ireland, of course, because you're still starting in Ireland. So being open-minded means that you are embracing the culture, the new routine of that particular place. It means that you're ready to learn or relearn those things that you've already learned and apply it correctly or based on what are the routines or what are the protocols of that particular hospital or area that you are placed here in Ireland, because we all know that it's a new, that's why it's called like adaptation, because you need to adapt. Okay, like for example, in the Philippines, when we do blood sugar monitoring, we usually disinfect it with alcohol swab. But here in Ireland, it's a new place. They don't practice to do that swabbing now. Instead, swab it direct. Disinfect it, or it means that you really directly stop or stick the patient with that glucometer or the pricker in order to take the blood sugar. So that's one for example. But being open-minded is very vague. I know you will get me, but you don't need to really stick on what you learned outside Ireland, because that's a different place. Second is patience. Patience. That's very important. The first week will be hell, because it's just a term, hell, because it's really disorganized, because your thoughts is processing something new, ideas and learnings. Because aside from in relation to number 1, which is being open-minded, patience is a virtue. That's what we are being patient means that you need to learn again what you've learned outside Ireland. I always emphasize outside Ireland because there are new things, although it's based on fundamentals of nursing that we've learned in the book, but still it's a new practice. So patience, being open-minded, and what else? Number 3 is being happy. Yeah. Why? Because if you want to learn and you're not happy of what you're doing, then it will be a failure eventually. So you need to be happy because of the idea that you already started your journey here in Ireland. And happiness means that you're being inspired and encouraged to do more and to fight those obstacles that is offered to you. Obstacles means that there are new routines that needs to be learned, especially communication. I know that we speak English, but it's different English here. You will get what I mean when once you started your adaptation. So just be yourself. Don't ever depend on someone's, it's you that you are the captain of yourself. So just be happy and do what is intended for you or expected to you from your facilitator. 4th is, can you guess? The 4th thing will be You need to, I will say, you need to be more communicative. You know, I can sense that most Irish facilitator or preceptor wanted to have a nurse who is willing to learn and very communicative. Because, mind you, we all know that before coming here in Ireland, we intend to pass an English licensure examination. That's why it's very important that you need to communicate. A good communication will result to a good quality of care. You communicate whatever did you observe or what did you do, and of course you can't communicate well if you will not speak to your facilitator. So you need to speak, and go with the flow. It means that when you do this particular nursing procedures or whatever want to do it during your adaptation, you need to speak, you need to embrace whatever it is. So communication is the key, one of the most important traits that you will need in order to pass the adaptation exam. Because we all know most of the theories, most the protocols, it could be learned. But once you don't speak, you don't tell, you don't communicate, that's useless. So communication. And fourth will be being studious. You need to be studious, guys. I mean, you need to study well. There are brochures, there are papers that is given to you. You need to familiarize those routine, those protocols, because every institution has different protocols. So you just need to learn those things, stick to it, and then practice. And mind you, the adaptation here in Ireland is not spoon feeding. Because mostly us, when we're starting, we expect that our preceptors will teach you blah blah blah, all of this. No. Some of the preceptor will tell you what to do, but the rest is your observations, and when you observe, you do. That's what is it. And you can ask your preceptor, but mind you, always asking is tantamount of being naive for that kind of setup. So ask what is relevant, don't ask what is irrelevant, and observe and apply and practice it. And then in that case, you'll be flying with your adaptation. And 5, trust yourself. Just remember, before starting all those lengthy processes, before coming here in Ireland, those dreams and those efforts. So you need to be strong, and of course, just be yourself. Be yourself in a way that you are professional, knowledgeable, communicative, open-minded, and adapting. Thank you very much, and see you here in Ireland. Bye, guys.